She's moving so much. That's the problem.
Should be fine. I know, this is the hard part. Okay. Couple more little taps. Right. Okay. Be careful. She does this.
Bring the head.
Okay. Couple good taps. Come on the other sides. Okay. I'll tell you when. Okay. There you go. Tap, 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 tap. Okay. Keep going. Wait a second. Okay. Okay. Not too hard. Just throw it ahead. Okay. Wait 1 second. 1 second. Okay. Then. Okay. Then keep going. Okay. That's it for those.
No, those are wolf teeth?
Yep.
And she only has 2 of them?
Yep. Wolf teeth serve no purpose in a horse's mouth. Can you hold it 1 second? I think that's my extension. Wolf teeth are like comparable to our wisdom teeth.
Wow.
They serve no purpose in a horse's mouth. And they will interfere with bidding. We usually take them out when they're the first time we do them. And yearlings, 2-year-olds. Okay, so you're good for now.
Okay.
Yep.
Yell
Yep.
when you're ready for another one, because I gotta go get one. Okay. She's right out there, the next one. But you've already done her
I'll
before.
be a few minutes.
How did she handle that? I mean,
Wolf teeth are comparable to our wisdom teeth. They usually sit in front of the first molar. They serve no purpose in a horse's mouth. And they will interfere with bidding. So we usually take them out when they're babies. First time we do them, we usually start horses at 18 to 24 months, 2 years, 2.5. And any good dentist is going to take them out first time he does them, like that. And then you never have to worry about them again. So there's 3 reasons we take them out. Number 1, they serve no purpose. Number 2, they sit just in front of the first permanent molar, or premolar. So you can't really do a nice bit seat, which is what we like to round off that first molar, kind of like the tip of your thumb. It makes them more comfortable and accepting of the bit. And once they're out, you never have to worry about them again. And they don't have a long root system, so they're easy to take out. Unlike a permanent molar, which you would have a horse this age would be very difficult to extract. And horses lose 24 baby teeth. So she's already lost all her baby teeth, except for her corner incisors.
Now somebody said they didn't have any nerves in there, so did she feel that when it came out, or?
Nah, well, wolf teeth is one part of dentistry that does hurt a little bit because you're elevating. When Cindy was tapping that mallet, what you're doing is you're elevating, kind of pushing back the soft tissue. Kind of like a dentist would do with you if you were having a tooth pulled. They push away the gingiva or the tissue around it so they can get it out easier. And horses' permanent molars and the molars are deep in the tooth and they don't feel it. That's why horses can chew on wood and crib. It doesn't really hurt them. Follow me?
Yep. Now what's this you're putting in?
This is a mouth speculum. This allows me to safely work the back areas of the mouth. So she's lost all her baby teeth.
That's good news.
Yeah. And if you tried to do wolf teeth without sedation, you probably wouldn't stand too good for it, because it is, most of my work floating is just what we call maintenance floating, like horses I do every 6 months. Basically you're just kind of following your own work and just kind of, giving my life float. But with a horse like this that's never been done, plus you're doing the wolf teeth, I wouldn't want to do it without sedation. Most dentistry that we do on a daily basis, as far as floating, is generally painless because they don't feel it. Like your teeth or mine, this would be pretty sore. This would hurt a little bit. But wolf teeth, in my opinion, is automatic sedation. I trank a lot of horses anyway. It makes it easier. They're just standing there as opposed to if they're fighting you and bouncing off the walls. Wolf teeth's automatic because if she wasn't sedated and Cindy took that mallet like she was, she'd hit the roof. Plus it would be a bad experience for her.
How often do they need their teeth floated?
A horse this age, every 6 months. 12, 15, if their mouths are good. And maybe because the reason we maintain horses, as you know, they have hypsodont teeth, which means they're always erupting. Did somebody take the wolf teeth out?
I did. Well, Cindy did, and then she gave them to me.
Yeah, you can have them. Well, that fan's working good.
Yeah.
I worked 13 years I've been practicing. I never used a fan. Unless there was one at the barn, but the other day I bought this because I said, hi, it's going to be a rough week. So.
Oh, yeah.
And some barns, you know, they got them up in the stalls so they don't do much. Move the air up, but this is working good. She's got a nice mouth other than that.
Does she? Oh,
yeah.
good.
She's nice. She's got a brain on her. I can tell. You know, even though people say, oh, you got to sedate it, believe me, some horses are still fight, even sedate. Nice looking, man. Really?
Yep.
How are you?
Good, how are you?
You getting some work done today?
Oh, yeah.
Good girl, Gigi. So now what I'm doing basically is just filing off all the sharp points. Has she been training?
Yes. Yep.
Ben been getting on her?
Oh, yeah. Yeah.
Seeing the bit will hit those wolf teeth. It won't get good contact.
Yeah, that's what he was saying. Now, will this help her to keep her head a little bit lower, or?
Yeah, it should help her in any respect as far as bidding goes. You know?
I mean,
what is she doing? Throwing her head in the air?
A little bit. Or she'll keep it up, maybe toss it a little bit, but...
Plus her teeth are sharp from not being floated. You know, the reason we maintain horses, as you know, their teeth are constantly erupting. And the eruption rate is about 2 millimeters a year, which is not a lot, but it's enough to create sharp enamel points. And they chew in a lateral motion, so they tend to sharpen up quickest on the inside of the upper lowers and the outside of the uppers. Because any area that doesn't come in contact with another tooth will tend to, you know, throw points and stuff. Like if a horse loses a permanent tooth, a mole will say, the opposing tooth will try to get high or low depending on, you know, where the tooth is missing from. And horses lose 24 baby teeth from 2.5 to 4.5. I'll explain that to you when I'm done.
Do you have another horse after this one?
Oh, I got a few.
Okay.
I don't know what order they are. Doesn't matter to me.
I think you have 5 total today.
Okay. Well,
I
like,
think-
Kayla's got to go in that huge field.
What's the
and
story about your horse?
less anesthesia this time.
Sorry?
Less anesthesia this time.
Oh, okay. Why? Is it lightweight?
Oh my God, it took at least 2 hours for her to start waking up.
Oh, okay.
There's who?
That, we can handle that. Good girl, Gigi. You're gonna feel like a new box. Yeah, she's gonna have a nice mouth.
Oh, good.
The wolf teeth are kind of comparable to our wisdom teeth. Most horses, I would say 80% of horses have 2. Some have 1. And in rare cases, they don't have any. They usually erupt at about 6 months to a year. And they come in all different shapes and sizes.
And once you take them out, they don't grow back?
No. So, you don't ever have to worry about those again. There's no need for them. They don't use them to come in contact for chewing purposes, you know. The molars go all the way back to here.
Oh, molars, okay.
We have 6 molars, top and bottom. That's 24.
Do those have to be taken out?
No.
Oh.
You don't know. You're a novice hospital.
Yeah.
How did I know that? It's alright. Getting a good lesson today.
Yeah, absolutely.
So, is she broke to ride? Have you been riding her?
Oh, yeah. No, I've ridden her.
Is she good? Good horse?
Yeah, absolutely. Absolutely.
Oh, that's good.
Yeah, she's still learning a few new things.
Oh, yeah. She's young.
Yeah.
Just a baby. Oh, Mama can't help.
But I think this will help a bit,
Oh,
definitely, with how
yeah.
she handles the bit. And maybe the way she carries her head a little bit.
Yeah. You know, obviously, there's a little hole there where I took the wolf teeth out. But horses' mouths heal remarkably fast. So, I mean, she should be healed up in a day or two. I mean, you could probably ride her tomorrow.
Oh, really?
Yeah.
Wow.
Those little holes that heal very fast.
So it's not like they need stitches or anything like that, right?
No, they heal up real quick. I do, you know, in the spring and the fall, I do a lot of healing. Thoroughbreds, standardbreds. Sometimes you'll do a new horse, 4, 5, 6 years old, you'll find a wolf tooth that somebody just left, never took out, for whatever reason. Any good dentist is going to take them out first time. Because there's no point in leaving them. It's just going to cause problems. See, there's not a whole lot of blood. She basically, by the time I'm done floating her, they're all like this.
Do they like it at all?
No.
I mean, does it...
I have some horses that absolutely don't require sedation because they don't do anything wrong. They just stand there. But usually, horses I've been doing for a while and they don't require a lot of work. Like most, when I do new horses, it all depends what kind of shape their teeth are in. A lot of times I'll sedate them just so I can get them done perfect. And then I use power tools also with certain things. High teeth or low teeth that you can't really file. You'd be 3 days trying to file them down. But most of my work is hand work.
Do you have to use power on her too?
Oh no.
Oh, good.
It's almost done.
Oh, good.
It's almost done. It's going to have a nice mouth.
Now, Cindy said she had a kind of like an overbite or a parrot mouth, or...
Oh, she's not a parrot.
Oh, that's good.
I'll look at her. Give me 1 second. Yeah, you see it?
Yeah, it's a little.
Not bad though. It's not that bad. But it will be important to do her on a regular basis, and I'll explain it to you in a minute. It's not bad, a little bit. I wouldn't call it a parrot mouth, I'd call it an overbite.
How common is that?
It's fairly common. Different degrees. You know, obviously you would like them to line up perfect, but a lot of horses don't. A lot of horses don't line up perfect.
Now, does that ever get corrected, or is that just how it is?
No, you can't do nothing about it. Just a confirmation fault. You know, I've seen horses a lot worse than her. Good horses like high-level jumpers and stuff. It's just you have to pay a little more attention to the maintenance. That's why I said every 6 months, because she's still young. The sedation I gave her a little less than I normally give for wolf teeth, because I didn't know her and it's pretty hot out. And the sedation will get them a little, make them a little warm sometimes. Do a little work on this right now.
Now, does anything need to be put on them? You know, like.
Put on what? On a teeth?
You know how they have.
What do you want me to put braces on them?
No. Like in cleaning their teeth, you know how sometimes they.
No, there's nothing you can do.
No, okay.
Mother Nature. You know, the discoloration, that's nothing to worry about. Because a lot of times, a place like this, they're out grazing a lot and they chew the dirt. Nothing that's going to hurt them. I'm not too worried about it. See, so they lose them like this. 2.5, 3.5, 4.5. See, this is still a baby tooth.
Oh.
This and this.
Oh, wow.
And on the other side too. And then they lose their molars 2 years, 6 months, 2 years, 8 months, 3.5. Then the back 3 erupt as permanents.
Oh, okay. Wow.
So between the time they're born and up until about 4, or when they lose the corner and size of the last baby tooth, there's a lot of changes going on in their mouth. You know, their mouths are really fast tracking, and they will get sharp quicker than an older horse.
So when will those other baby teeth fall out?
Probably within the next few months. Because you know her exact age. I know she's at least
4. Yep, May 17th. She just turned 4.
Probably a couple months. Next time I'm here, I could check her. Basically, what happens is the permanent tooth just pushes it out, and they're not ready right now. If I tried to take them out now, it would take too much tissue with it. It would be a bloody mess. And you know, there's no need. Like horses in the wild, their baby teeth just fall out. It's no big deal. It's kind of like a little kid. When a little kid loses their baby teeth, I mean, if it's loose, you don't run up and yank it out with a pair of pliers. You basically just wait till they can almost flick it out with their tongue. You know? So, no big deal. It's all done.
Oh, wonderful. And Tommy, you're from Boston?
Yeah, I live in Winthrop, which is just north of Logan Airport.
Oh, okay. What's your last name?
Moss.
Moss. Okay.
Yeah,
That's
this
fantastic.
is a long ride. This is a long ride for me. But I've been coming here for number of years.
Well, it should be worth it for you because you got quite a few to do today.
Yeah,
It's great.
it's hot.
Well, thank you so much.
Not looking to do a ton of horses. Hold on 1 minute, don't move it, just wait yet.
Do you have any objection if I put this up on Facebook for my other horsey friends to see?
No?
Okay, that's awesome. Her seller is.
Facebook? How do you put it on Facebook?
Oh, you just
mean
upload the.
YouTube?
Yeah, well, you can put it on Facebook, but a lot of.
Oh, just a picture.
Yeah.
Oh.
Awesome. Thanks, Tommy.